why is having a spay or neuter different at UVH?
Right, so a spay or neuter is something that all of our pets, unless they come to you that way from an adoption, are going to need. And so this is a surgical procedure that is being done pretty early on in life. And it's very, very important that things are planned out and customized for your pet. And that's one big difference. Now, with that anesthesia is the scariest thing for a pet parent.
Sure.
But it's important to know that at UVH we have a dedicated nurse that is with your pet, and that is before they're anesthetized, during their entire anesthesia event, and then through recovery.
Yes.
Now, the other thing is in anesthesia is that whenever an animal is anesthetized, and we're using medications that are very similar to what's used in us, and with that we want the safest way for anesthesia, what we believe are medications that work very quickly, and then they're out of the animal very quickly. And that's the same thing that if you or I were having a procedure, that would be done. The older medications where animals and or people would be hung over for days from these drugs, those are not safe. And the reason that they're not safe is that we want total control over all the body's systems. And in an anesthetized pet, the body's normal control systems aren't there. So monitoring is the next big thing, is that we are knowing what the body's doing so we can make an adjustments. And this is to blood pressure, this is to heart rate, this is to oxygen, this is to carbon dioxide, this is to temperature, this is to
ECG.
Correct. So all these things are being monitored and recorded throughout, and adjustments are being made. From there, I do think that keeping them nice and warm, keeping them in a pain-free state, and pain management is a big part of what we practice, and that's both local nerve blocks as well as being on appropriate IV as well as oral pain medication, so that they're as comfortable as can be. So we always have pet safety on mind. This is something that we absolutely pride ourselves in, and we think we do a great job with.
We really do. And for the pets that are going to stay the night after their spay or neuter procedure, we have a nurse with them, and this is a trained, dedicated nurse, and their primary responsibility is just the inpatients and to kind of go monitor some of the boarding pets that might need a little peek. But it's very nice to know that your pet's never left alone. That's very reassuring for me as their doctor.
That's right. And then another thing that we're practicing is minimally invasive procedures. And so we're doing these procedures using a small incision as possible, using cameras when indicated to actually operate through there. And the cool thing about that is they feel so good so quickly.
Mm-hmm.